Hello and welcome to Feel Better, Your Mental Health Matters, our first webinar workshop for practicing physicians and their medical staff. We're so happy to have you here. For your information, Feel Better, Your Mental Health Matters is a coalition of 27 major insurance companies in the United States, insuring 82% of the American population. The purpose of the Feel Better initiative is to raise awareness surrounding mental health and advance mental health treatment through increased education and access to mental health resources. Before we get started, I want to remind everyone to have a copy of the packet you received when you signed up for this workshop. It has useful tools and resources that we'll be using today. All right, with that introduction, let's get started. We're going to be discussing different ways that you as physicians can identify and help patients talk about anxiety and depression. Many individuals, as I'm sure you know, may find it difficult to approach the topic of mental health. In some communities and cultures, there can be a very strong negative stigma surrounding mental health. We want your patients to feel comfortable talking to you about their own mental health and their mental health struggles. So our first activity is going to help familiarize you with a mental health screening questionnaire. If you'll open up your packets, you'll see a copy of this questionnaire. Some of you may already use mental health screening questionnaires in your office, and this isn't meant to replace those, only to aid as an additional resource. We're going to give you 5 minutes to fill out this questionnaire for yourself. Afterwards, you won't be asked to reveal any of your individual responses, but we'll have a brief discussion on any insights or questions that you may have. We're going to pause for 5 minutes so that you can fill that out, and we will meet together again. Okay, let's open up the discussion about any questions or insights you had regarding the mental health screening questionnaire. All right, let's move on to our next section, which discusses the topic of anxiety and depression in your clinical appointments. You, as physicians, often have a list of questions that you frequently ask your patients. Those questions range from alcohol use to sexual activity. You use these questions to create a broad picture of your patient's overall health. By adding a few simple questions to your routine questions, you can help patients begin to identify symptoms and signs of mental health. Let's look at these sample questions, but before we talk about that, let's open it up to the group and ask if any of you already ask any mental health screening questions on a regular basis when you meet with your patients. Okay, everyone, thank you for sharing. I'm glad to hear that some of you have already started asking questions about your patient's mental health status. So here are a few suggestions. An easy question to start with is asking how your patient's quality of sleep is. You can ask them follow-up questions to see if any sleeping patterns have changed recently. As you know, you as physicians know that depression can lead to sleeping too much, while anxiety can have the same effect or be a cause for not sleeping enough. Another way to ask is asking about their general mood recently. For follow-up questions, if they feel more sad or hopeless, perhaps even if they are more irritable than they used to be. Our final suggestion for general mental health questions is stress-related. Asking if their current rate of stress has increased, if it's affecting their daily life, or any other stress-related questions. Occasionally, or actually quite frequently, patients may confuse anxiety or depression symptoms with increased stress and vice versa. So that can give you helpful insight. Okay, our next segment, we are going to step into some breakout rooms that you'll automatically be placed into. You're just going to be randomly entered into a group of 2 or 3 other workshop participants. While in your breakout rooms, please briefly introduce yourself, including your name, the type of medicine that you practice, where you are located, your general staff size, one struggle your practice has on a regular basis, one thing you like about your current practice, and then begin a discussion about how mental health issues are currently handled in your office. With your remaining time, continue your discussion and ask each other different questions. You'll have about 10 minutes in these breakout rooms. Let's go ahead and get started. Great. I hope that you were able to connect with each other and begin working relationships with each other as we discuss mental health. Our next segment will be talking about before you even see a patient. Before you see them, they will have scheduled an appointment with your receptionist. That will be their first point of contact with your office. In your office, when someone calls to schedule an appointment, are they asked for what reason they need to schedule that appointment? Many patients may not feel comfortable telling your receptionist why they are scheduling an appointment. If this issue arises, we have a few suggestions that may be able to help you identify mental health patients before you see them. Your receptionist can offer suggestions of topics of appointments. So if a patient says, I just need to meet with a doctor, your receptionist can say, that's great. We just need to give the doctor an idea of what you'll be discussing. You can say current illness, annual exam, medication questions or concerns, mental health questions or concerns, or other physical ailments. Giving your patients a brief summary of different types of topics may help them identify more what they want to speak with you about and also feel more comfortable telling your receptionist why they need to see you. Let's talk about those mental health screenings from the beginning of this workshop. We suggest that you have your patients fill out a mental health screening form every 3 months. That may seem excessive. However, life circumstances and mental health can change on a regular and frequent basis. These mental health screening questionnaires can be mailed, emailed, or texted out to your patients when they schedule an appointment with you. There are automated services that your office can begin to use that will do this for you. Additionally, your patients can fill out these questionnaires in person when they check in. Mental health patients can often struggle with keeping commitments. So we suggest that you follow up with patients who have continuously rescheduled or canceled, as well as no-showed. We all know how frustrating it can be to work in a busy office and have a patient just not show up, not call to cancel. However, this can be an indication of mental illness going on. So if your office can institute a new policy where your receptionists check in on your patients who no-showed by saying something like, we noticed that you missed your appointment. Dr. Johnson has asked me to call and reschedule with you. Your appointment is important to her. Will give your patients a personable quality that your office can possess, and they can check up on why they missed their appointment. We suggest that you do this for any appointment that has been rescheduled or canceled 3 or more times. In conclusion, we want to thank you for all that you do for your communities. Together, we can help others learn about and recognize mental health for what it is and seek the treatment to increase their quality of life. Posters for your offices and exam rooms are available completely free of charge on our website. You can also find a database of all mental health professionals in your area. If you have any questions or comments, please stick around. I'll be available after the workshop ends. Thank you for attending, and remember that your mental health matters.